Okay, so wow, get this. Something like 1 billion people around the world, 1 billion, are dealing with high blood pressure. It's a lot, right?
It is. It's huge. And, if you're one of them, or even if you're just, thinking about how to keep your heart healthy, this deep dive, this is for you.
It really is because, and you can tell us more about this, high blood pressure, it's not something you always feel.
Right.
It can be sneaky, but it leads to some pretty serious stuff.
Yeah, exactly. Hypertension, that's the medical term for it. It can really increase your risk for like strokes, heart attacks, kidney problems, heart failure even.
So yeah, not something to mess around with. So we're doing a deep dive today on antihypertensive drugs, the medications that help manage high blood pressure.
We're going to try to break it all down, make it clear.
Exactly. And we're basing this on some information we have here.
It's called, let's see, the Oisillon-Jules is in, well, we'll get to that.
And the goal today is to understand the different types of these medications, how they work, what side effects to watch out for, and also how lifestyle choices, even things like fasting, can play a role.
Because it's all connected, and understanding these medications can really help people take control of their health.
So first things first, just to level set, what exactly are we talking about when we say high blood pressure? What does that actually mean?
So blood pressure is basically the force of your blood pushing against the walls of your arteries as your heart pumps. And every time your heart beats, it creates pressure. And that's what we measure.
Right, and we get those two numbers, right?
Exactly, the systolic over the diastolic. Systolic is the pressure when your heart beats, contracts, pushes the blood out, and diastolic is the pressure when your heart relaxes between beats.
Okay, and so what's a normal reading? Like, where do we want to be?
So ideally, you want your blood pressure to be below 120/80. That's generally considered healthy.
Okay, 120/80, got it. So then, when does it become a problem? When do we start talking about hypertension?
Right. So, it's not like you hit 121/81 and suddenly you have hypertension. It's more of a range.
Okay, so walk us through that. Like, what are the different levels or categories?
Sure. So if your systolic, that top number, is consistently between 120 and 130, and your diastolic is below 80, that's considered elevated blood pressure.
Okay, so not quite hypertension yet, but getting up there.
Right. It's something to keep an eye on, definitely. Then we move into the stages of hypertension. Stage 1 hypertension is diagnosed when your systolic is consistently between 130 and 139, or your diastolic is between 80 and 89.
So that's when it's officially high blood pressure.
Exactly. Then stage 2 is a bit more serious. That's when either your systolic is 140 or higher, or your diastolic is 90 or higher.
Okay, so those are the stages. And then is there like an even more serious level?
Yeah, there's what's called a hypertensive crisis, and that's when blood pressure spikes dramatically to over 180 systolic or over 120 diastolic.
And that's like a get to the hospital now kind of situation.
Absolutely, it's a medical emergency.
Okay, so let's talk about what to do about it. Let's say someone's in that elevated blood pressure category, or even stage 1 hypertension. What's usually the first step?
So before we even talk about medication, the most important thing for anyone with elevated or stage 1 hypertension is lifestyle modifications. Things like losing weight if you need to, eating a heart-healthy diet, getting regular exercise.
I would say 6.
Yeah, but they make a big difference. Also, reducing sodium intake, being mindful of alcohol consumption, those things can sometimes be enough to bring blood pressure down without medication.
That makes sense. So build that strong foundation first. But what if someone is already at stage 2 or lifestyle changes just aren't enough? Is that when medication comes in?
Yeah, exactly. For stage 2 hypertension, the general recommendation is to start antihypertensive medications with the goal of getting the blood pressure below 130/80.
Okay, and that's the same target, I assume, for people with elevated or stage 1 who need medication.
Right, generally. But it's interesting, our source points out that for people with chronic kidney disease or type 2 diabetes, that same target of below a 130/80 is usually recommended even if they're not yet at stage 2.
Oh, I see. So those conditions make it even more important to control blood pressure early on.
Exactly.
Okay, so let's talk about these medications. What are the main types of antihypertensive drugs?
Well, there are a few that are considered first-line medications, the ones that are often prescribed first. These include thiazide diuretics, ACE inhibitors, and calcium channel blockers.
Okay, those are names I've heard before. Can you break down how those work? Like, what do they actually do in the body?
Sure. So thiazide diuretics, they work by helping your body get rid of extra salt and water through your urine. Basically, they reduce the overall volume of fluid in your blood vessels, which helps lower the pressure.
Okay, so it's like draining some of the water out of a water balloon.
Yeah, kind of like that. ACE inhibitors, on the other hand, they work a bit differently. They prevent your body from producing a hormone called angiotensin II.
Angiotensin II, okay. And what does that hormone do?
This hormone normally narrows your blood vessels, so by blocking its production, ACE inhibitors help your blood vessels relax and widen.
Okay, so they open things up, make it easier for blood to flow.
Exactly. And then you have calcium channel blockers. These interfere with the movement of calcium into the muscle cells of your blood vessel walls.
Okay, I'm guessing calcium has something to do with those muscles contracting.
You got it. Calcium causes the muscles to contract, so by blocking it, these medications help the muscles relax and the blood vessels dilate, again, making it easier for blood to flow through.
So those are the big three, the first-line medications. But I know there are other types of blood pressure medications too, right? What are some of those?
Yeah, there are several other classes that doctors might use. We have adrenergic blockers, which is kind of a big umbrella term. That includes alpha blockers, alpha beta blockers, and peripherally acting adrenergic blockers. It's a mouthful.
It is. So what do all those blockers do?
Basically, they work by blocking the effects of certain stress hormones on your blood vessels and heart. Hormones like adrenaline, for example. This helps slow down your heart rate and relax your blood vessels.
So less stress on the system, less pressure. Makes sense. What else is there?
Then we have angiotensin II receptor blockers, or ARBs for short. These work in a similar way to ACE inhibitors, but instead of preventing the production of angiotensin II, they block it from binding to its receptors on your blood vessels so it can't cause them to constrict.
Okay, so same goal, different approach.
Exactly. Then there are centrally acting alpha agonists. These are interesting. They work by affecting the part of your brain that controls your nervous system. It's a more central approach.
So they calm down the signals from the brain that tell blood vessels to narrow.
Precisely. And then we have direct vasodilators, which, as the name suggests, directly relax the muscles in your blood vessel walls, causing the vessels to open up.
Okay, so those are pretty straightforward.
Oh.
Anything else?
Oh, and there are other types of diuretics besides thiazide diuretics, like potassium-sparing diuretics and loop diuretics. These also help your kidneys get rid of extra fluid and salt, but they might be used in different situations or combined with thiazide diuretics.
It sounds like there's a whole arsenal of medications for managing blood pressure. But with so many different types, I imagine there are also a lot of potential side effects.
Yeah, that's definitely something to be aware of. Each class of medication can have its own set of potential side effects.
So what are some of the common ones people should know about?
Okay, so for adrenergic blockers, common side effects can include things like fainting, dizziness, feeling tired, and a slower than normal heart rate.
Those sound like they could be pretty disruptive.
Yeah, definitely something to discuss with your doctor if you experience them. With ACE inhibitors, some people might get a persistent cough or have elevated potassium levels.
Okay, anything more serious to watch out for?
Yeah, actually. Dizziness can be a side effect, and there's also a potentially dangerous reaction called angioedema.
Angioedema, that sounds not good.
It's not. It involves swelling of the face, lips, tongue, or throat. It can be pretty scary, and if it happens, you need to stop taking ACE inhibitors and see a doctor right away.
That's really good to know. What about ARBs? Any side effects there?
ARBs can also sometimes cause elevated potassium levels, and dizziness is a possible side effect as well.
Okay, so similar to ACE inhibitors in some ways. What about calcium channel blockers?
With those, you might get headaches, dizziness, a heart rate that's either too fast or too slow, and sometimes swelling in the lower legs.
So quite a range of possibilities. What about those centrally acting alpha agonists, the ones that work on the brain?
Those can cause tiredness, dry mouth, and a slower heart rate.
And direct vasodilators?
Direct vasodilators might cause a rapid heart rate, headache, and swelling in the lower legs, similar to calcium channel blockers.
Okay, and lastly, the diuretics.
Diuretics, as a group, can lead to imbalances in electrolytes like magnesium and potassium, which can be either too high or too low. They can also cause upset stomach, elevated uric acid levels, and dizziness.
It seems like side effects are a pretty common theme with these medications.
They can be, yeah, and that's why it's so important to be aware of them and talk to your doctor about anything you're experiencing.
Absolutely. Now, let's say someone's taking their medication as prescribed, but their blood pressure is still high. What are some reasons that might happen?
Well, sometimes it's simply a matter of needing more than one medication. You might need 2, 3, or even 4 different antihypertensive drugs to get your blood pressure under control.
So like a combination therapy.
Exactly. And it's important that those medications work in different ways, target different mechanisms. It's not just about taking more pills, it's about finding the right combination.
Makes sense. What else could be going on?
Sometimes it's about consistency. If you're not taking your medication every day as prescribed, it's not going to be as effective.
Yeah, that seems obvious, but I'm sure it happens.
It does, yeah. And then diet plays a huge role. If you're eating a lot of sodium, that can definitely counteract the effects of your medication.
So even if you're taking your pills, you still need to watch what you eat.
Absolutely. And some medications, even over-the-counter ones, can cause your body to retain salt and water, which can also make it harder to control blood pressure.
Okay, so it's not just about the blood pressure medication, it's about everything else you're putting into your body.
Exactly. And another thing our source mentions is the importance of diuretics. For many people with high blood pressure, a diuretic is really important, and if you're not taking one when you need it, that could be a factor.
So are there any other underlying health issues that could be causing blood pressure to stay high even with medication?
Yeah, there's something called secondary hypertension,
Hmm.
which means the high blood pressure is actually caused by another medical condition.
Oh, I see. So it's not the primary problem, it's a symptom of something else.
Exactly. Things like hyperaldosteronism, pheochromocytoma, renal artery stenosis, those can all cause secondary hypertension.
Those sound pretty serious.
They can be, yeah. And then there are also interactions with other medications. Certain drugs, including some herbal supplements, can interfere with how well blood pressure medications work.
So if you're taking other medications, it's really important to talk to your doctor about that.
Absolutely. And, recreational drugs can also play a role.
So the takeaway here is that managing high blood pressure is complex. It's not just about popping a pill, it's about lifestyle, other health conditions, and really working closely with your doctor.
I think that's a really good summary.
Okay, so we talked earlier about lifestyle changes being the first step for elevated blood pressure and stage 1 hypertension. But it sounds like those changes are important even if someone is on medication.
Yeah, definitely. The source really emphasizes that lifestyle modifications are recommended for everyone with elevated blood pressure and stage 1 hypertension, and they remain crucial even if you're on medication for higher stages.
So it's not an either, it's both.
Right. And remember those key lifestyle changes we talked about. Managing your weight, eating a healthy diet, regular exercise, limiting sodium, and watching your alcohol intake. Those things work hand in hand with medication.
So just to be clear, if we recap the treatment guidelines, for elevated blood pressure and stage 1, the focus is on those lifestyle changes. And then for stage 2, medication is usually started with the goal of getting blood pressure below 130/80.
Exactly. And that same target blood pressure applies to people with chronic kidney disease or type 2 diabetes, even if they're not yet at stage 2.
Okay, so that's the goal. And what's the big picture benefit of hitting that target? Why is it so important to get blood pressure down?
It's all about reducing your risk of serious problems down the road. Getting that blood pressure down, especially the systolic below 130, can significantly lower your risk of heart attacks, strokes, heart failure, kidney problems, all sorts of things.
So it's really worth the effort to get it under control. Now, there's one more thing I want to touch on that I know a lot of people are curious about, and that's the relationship between blood pressure medication and fasting, whether it's for religious reasons, like in Islam, or intermittent fasting for health.
Yeah, that's an interesting connection. And our source does point out that fasting in both those contexts can affect blood pressure and might actually be a helpful way to lower it and improve overall health.
So it kind of ties back into those lifestyle changes.
Exactly.
So for someone who's fasting and also taking blood pressure medication, are there any special things they need to keep in mind?
While the source emphasizes the importance of taking your medication at the same time each day, and while it doesn't give specific advice about adjusting medication timing during fasting, it's generally best to be consistent. But, because fasting can affect blood pressure and it might interact with medications, it's really important to talk to your doctor if you're fasting regularly and taking blood pressure medications. They can give you personalized advice.
Yeah, always good advice. Consult your doctor, especially when you're making big changes to your diet or routine. So to wrap up this deep dive, let's just recap what we covered.
We started by talking about how common high blood pressure is and why it's so important to manage it.
We went through the different types of blood pressure medications, how they work, what the potential side effects are.
We talked about why blood pressure might stay high even when someone is taking medication.
And we really stressed the importance of lifestyle changes.
We also covered treatment guidelines for the different stages of hypertension and that target blood pressure of below 130/80.
And then we touched on fasting and how it might relate to blood pressure and medication.
A lot of information.
It is, but hopefully this gives everyone listening a better understanding of how high blood pressure is managed, the medications involved, and the big picture of keeping your heart healthy.
Absolutely.
And, as you go forward, think about what you've learned today. Think about your own health and your own habits. What changes might you want to explore? What questions do you want to ask your doctor? It's your health, your journey.